Yuck. Well, amazing advances in medical technology and pharmaceuticals allow us to live longer than ever. But are we doing the things now that will make our golden years truly golden? Dr. Milady Murphy is here from the Shelton State Wellness Center to tell me about the benefits of strength training as we age. Dr. Murphy, thank you very much for being with us today.
Pleasure to be here, Danny. You know, according to the American Medical Association, 30% of the public that's 65 and older fall annually. Many of the injuries that result from that cause major disabilities and even death. And this is a worldwide problem. What they're now finding out, believe it or not, strength training and resistance training is one of the most powerful tools one can incorporate into their lifestyle to prevent falling or injuries.
So it's not just a matter of, losing your coordination or your balance as you age. It's also strength that keeps you upright and stops you from having accidents in the bathroom.
You are absolutely right, Danny. We lose balance, but when we lose balance, we lose strength, and we also lose bone density. Those three issues. And so what the research is now showing is strength training, resistance training, whether done one-on-one with a personal trainer, whether done in community-based exercise programs or walking programs. Those are all powerful tools to reverse that negative process of aging. After the age of 25, we all lose muscle. When we lose muscle, we lose balance, and we also lose that bone density. Strength training counteracts that negative process.
And strength training is it's going to be low reps and high weight, correct?
Well, the American College of Sport Medicine says keep it very simple. They said we can use very light weights, anywhere between 8 to 12 repetitions. And so strength training doesn't have to be heavy weights for it to be effective to counteract that negative process of aging. So if someone doesn't know what they're doing in starting out, hire a personal trainer. If someone is injured, talk to their physician about seeking, going to physical therapy to help them with resistance training or strength training. It doesn't have to be athletic in nature for it to be effective.
Now, in your opinion, when is a good time for people to start to become involved in a gym or working with weights? Because that's different from going out and running or jogging. I mean, you got to know what you're doing because you can hurt yourself. When's a good age? What do you determine?
Well, you know what I'm going to say? As soon as you're able to do it at a proper age, it's when we're in our college years. People need to learn the ways of a gym. If they're not familiar with it, do get professional help and guidance. But what we now know, Danny, is if you put muscle on the body as you age, it keeps your metabolism up, so we regulate our weight better. It also helps with type 2 diabetes. That's very powerful. We're now seeing a proliferation of type 2 diabetes, even with young folks. So putting muscle on the body helps the body to regulate blood sugar. It also keeps the bones strong. Strong muscles, strong bones, weak muscles, weak bones. It goes hand in hand. You're now seeing osteoporosis in kids as young as 13 and 14 years of age. So if you say to me, well, when should we start strength training? As soon as you want to go to a gym, or as soon as you want to work with a personal trainer, get a video and exercise in the house with resistance training. Walking is a form of resistance training. Using rubber bands or little handheld weights are a form of resistance training. It doesn't have to be complex in nature for it to be effective.
All righty. Well, Dr. Murphy, get in the gym, do some chin-ups.
There you go.
Inspired me. Thank you for being with us.
My pleasure.
The Health and Wellness Center is located at Shelton State Community College. You can find out more about them online at sheltonstate.edu.